Hello, now we are going to learn about case history. This is the definition of the case history. What is a case history? It is a planned professional conversation that enables the patient to communicate with his or her symptoms, feelings, fears to the clinician. That means to doctor. So, as to obtain insight into the patient's illness nature and her attitude towards them. This is the definition of the case history. What are the objectives of the case history? While we have to take the case history because it establishes a positive professional relationship with the patient, and it also provides us with the information concerning the dental, medical and personal history of the patient. With this information we can make the diagnosis easily, and after diagnosis we can make the treatment plan also according to the case history. So these are the objectives of case history. What are the steps in the case history making? Okay, usually first we have to gather all the information of the patient, starting from the chief complaint statistics. Okay, statistics nothing but age of the patient and everything, statistics of the patient. Then we have to record the chief complaint, medical history, dental history and all the diagnostic test. Then there are three types of diagnosis possible in the case history. The first one is provisional diagnosis. That means while taking the case history we will gather all the information. So based on the information we will give a diagnosis, an imaginary diagnosis or a diagnosis which is related to the history of the patient. That is called as a provisional diagnosis. Remember, it is not a final diagnosis. Okay, just by seeing all the clinical examination and everything will give just a provisional diagnosis. Then after the provisional diagnosis we have to think other diagnosis also, because it is not a final diagnosis. So we can think in the other way also, like other than the disease, which other disease can occur. So that type of diagnosis are called as a differential diagnosis. This differential diagnosis is given for all possible complications. Okay, first seeing the case history you have to give the provisional diagnosis, then you have to make the differential diagnosis, and finally we can give the final diagnosis. This final diagnosis will arrive only after a particular confirmatory diagnostic test or a histopathological report and everything. Based on that we can give the final diagnosis. Okay, so three types of diagnosis in history taking are provisional, differential and final. And finally after the diagnosis we can plan a effective treatment according to the diagnosis. So we have seen that case history is nothing but obtaining all the information from the patient. Okay, so how we can obtain the patient information? There are three methods. The first one is interview method, health questionnaire and combination of these types. So interview, coming to what is interview of the patient. Interview is nothing but we will ask the patient about all the questions, all his questions regarding the health in an organized fashion. Okay, what are the disadvantages of this? This depends on only skill of the clinician. Okay, so the skill means what questions we have to ask based on his complaints we have to think. So this completely depends upon the skill of an interviewer. And sometimes the clinician may skip some of the important topics also while interviewing, and this interview requires a definite good time. So these are the disadvantages of interview method. And one more method we have seen, that is the health questionnaire. Okay, health questionnaire is nothing but already there will be a format of questions which are printed on a paper. So we will give the paper to the patient and we will request his or her to answer the questions in the first appointment only. Okay, so what is the advantage? So it takes only, already there is in a printed format, so there is no need to ask the patient. So there will be little time, it takes only a little time, and it will be a standardized approach because we will give a questions in an organized format, so there is no missing important topic. So hence it is a standardized approach to the patient. And what are the disadvantages? As we will take only a little time for the questionnaire, we cannot build a good rapport with the patient, and few patients may not think accurately regarding the questions and they give false answers also. So these are the disadvantages for the health questionnaires. And the final method is the combination method. That means we will interview plus questionnaire. So this is best method, because we will, by interview we can build a rapport with the patient, and with the questionnaire there is the thing that we will not miss any topic or a important thing asking the patient. Usually this is a best method. What are the components of the case history? Statistics, chief complaint, history of present illness, medical, past dental, personal history, general examination, extraoral examination, intraoral examination, provisional diagnosis, investigations, final diagnosis, and treatment plan. All these are the components of a case history. What are the first component? That is statistics. Statistics include patient registration number, date, name, age of the patient, sex of the patient, address, occupation, marital status. Okay, remember each and everything has a good significance. Okay, we should not miss anything in the statistics, because each and every statistics has a very good important significance. We will see the significance of each and every statistics now. First is patient registration number. Why patient registration number is given? So that we can maintain a record for billing purposes and the medical legal aspects. This is very important, because few cases in our dentistry there will be of medical legal aspects. So if by giving this registration number, easily you can present in the legal system also. Date includes what is the significance? It shows the time of admission, reference during follow-up visits, because in many of our dental treatments, like in periodontal surgeries or in a minor surgical procedures, we'll ask the patient for the follow-up, for the maintenance phase. So by making the recording the time, we will have a good reference during follow-up visits and to record the maintenance. This is the regarding the date. Name is to communicate with the patient, to establish a rapport, to record the maintenance, and the psychological benefits also. Age is for the diagnosis, treatment planning, behavior management techniques. As we know, behavior management techniques are necessary for the children, and few diseases are related to age. We will see that. If you see diseases, why age is important? Because diseases commonly present at birth includes micrognathia, cleft lip and palate, ankyloglossia, predeciduous dentition, teratoma, hemophilia. Okay, so these are the diseases commonly present at the birth. And in the children and young adults, these are the diseases like migratory glossitis, juvenile periodontitis, pemphigus, recurrent aphthous, dental caries, dentigerous, diphtheria, rickets, and infectious mononucleosis. These are the diseases present in children and young adults. And adults and older patients, we will see mostly the gingival problems, lichen planus or ameloblastoma, trigeminal neuralgia, hypertension, diabetes are very important for us. So hence age is important in recording. And age, with the help of age also, we'll calculate the dose of the drug, because in children we have to calculate the dose of the drug based on the age and weight. You can see the child dose. There are 3 formulas given here based on the child age or the adult child age. Okay, so hence age is important in recording. Sex, what is the significance here? Because gender specific diseases we will see. If you see these are the diseases which are common in males, and these are the diseases common in females. Okay, and this Gender is also important because drug interaction, usually in females during pregnancy, many of the drugs are contraindicated, and during lactation there are many drugs which have a special drug interaction. So hence the gender specification is also a very important thing here. Address. Why address is important? For future correspondence, and it also gives a socio-economic status, so that to know about the nourishment and the payment capacity of the patient, if you see. And also this is very important because prevalence of few diseases, example fluorosis, is also can be recorded based on the address. Occupation, to see the socio-economic status. And few diseases are also occupational diseases, like hepatitis B is common in dentist and surgeon, and other farmers we can see the deep fungal infections or respiratory infections. So it is very important to note the occupation also. And marital status, this is very important because of any history of consanguineous marriages, because many developmental anomalies of teeth and face we can see with the consanguinity rates. Hence this marital status is also important. Coming to the chief complaint, everyone know that chief complaint is recorded in his patient's own words in the chronological order. That means we have to record the thing which has appeared first. So first, if the patient say swelling came first and next the pain, you have to record in the same order, that is swelling and next pain, and you have to write when the swelling has appeared, since how many days, whether it is regressed or aggressive, and the pain increased when it is appeared. So we have to record in the patient own words, and chief complaint mainly aids in the diagnosis and treatment. So it is a very important thing, chief complaint. Coming to the history of present illness, you have to elaborate the chief complaint in detail. Okay, you have to ask about the associated symptoms. That means if the pain is there, you can ask mode and cause of onset, duration, whether it is localized, diffuse, referred or radiating, whether it is continuous or intermittent, aggravating factors like when it is aggravated while taking heat food or cold food, and treatment taken, any treatment or any painkillers, antibiotics he had taken before. You have to record everything in the history of present illness. And common chief complaint we will see here are pain, swelling and ulcer. Usually we will see these things. Coming to the pain, what you have to ask? You have to record original site of the pain, origin and mode of onset, site of the pain, whether it is near the lower jaw or upper jaw, origin and mode of onset, whether it has occurred mild, then it increased a thing. You have to write severity of the pain, nature of the pain, progression, duration, movement of the pain, periodicity of the pain, effect of functional activity, that means he has any numbness or any chewing difficulty, aggravating factors, relieving factors, associated symptoms and treatment taken, all these things. In severity, whether it is mild, nature, pricking or stabbing pain, progression of the pain, whether it is increasing, duration, since how long it is, movement of pain, from where it is coming, and periodicity of the pain, that means whether it is during the night or day or afternoon or complete total day. You have to record the for the pain. So origin and mode of onset, this is anatomy part, you have to consider whether from where it is coming. Intensity, whether it is mild, moderate or severe. Nature, whether it is throbbing or shooting, stabbing, dull aching, lancinating, boring, gripping, sharp, gnawing and squeezing. Okay, and progression, how is it progressing? So you have to ask whether it begin on a weak note and gradually reach a peak, or it begin with a maximum intensity, or it disappears on some time. So you have to write the progression of the pain also. And duration of the pain, from the time of onset to the time of pain disappearance. Movement means it is a referred or radiating or a migration of the pain. Periodicity, interval of days, weeks, months. Okay, and functional activity shows when increased on brushing, shaving, washing. All is important because neurological pains will increase even on touching the face also. So all these things are important. Aggravating factors, that means whether it is aggravated with chewing or relieved with chewing, you have to ask all these things. And associated symptoms like severe pain, there is any pallor, sweating, vomiting, and treatment taken, any previous medication he has taken. And swelling, what is used regarding swelling? So duration, for how many days the swelling is present, whether it is a slow growth, mass that increase in size just before eating, because salivary gland disorders will have this slow growth. So slow growth means if there is a chronic infection cyst or a benign tumor. Rapid means it is an abscess, infected cyst or hematoma. Mass with accompanying fever, you have to see concern about infection and lymphoma. So for symptoms also, you should ask like there is any pain, difficulty in respirating, swallowing, all these things you have to see. Progression of the swelling, whether it is increased in size or decreased in size. Fever, presence of other swelling, or loss of body weight. Because loss of body weight, you have to think about the carcinomatous. Secondary changes like softening, ulceration, or any inflammatory changes. Recurrence of the swelling, because usually the malignant changes, if there is any malignant change, the swelling usually recurs. So all these things you have to consider. Then coming to the ulcer. Ulcer, mode of onset, that means duration of the ulcer you have to note. Pain, ulcer associated with inflammation or painful, and whereas epithelial or basal cell carcinoma are painless. So ulcer should be painful. Remember, if it is painless ulcer, you have to concern or worried about the carcinomatous changes in the ulcer. Discharge from the ulcer like any blood, pus or serum. And associated disease, because in many systemic diseases you will see the ulcers in the oral cavity also, like tuberculosis, diabetes and syphilis. So you have to see an associated disease also. And these are the coming to next is the medical history. The medical history, there is in Scully and Cawson, they have given a checklist for that. This is A B C D E F G H I J K. These are the systemic disorders, and the histories you have to note. And any serious or significant illness, you have to write any previous record of hospital admission and any transfusion. Because if he has undergone transfusion, you have to think about rarely few transmissible diseases that patient might get. Any allergies, drug allergies, you have to see. Medications, that is component medications you have to see, and any allergies with the medication. And pregnancy, because many of the drugs we will give have interactions, and this is very important to prevent exposure to the ionizing radiation. You have to ask the female of this fertile period for any pregnancy history also. In case of young patient, you can ask for the parents like RH incompatibility, jaundice and trauma due to forceps delivery. All these may have some developmental anomalies that can be found in the teeth or the face. Hence, you can take this type of case history also. Next, postnatal history. Usually you have to ask about breastfeed and bottle feed. Why this is important? Because ortho problems, okay, if the child has persistent thumb sucking or any breastfeeding or bottle feeding habits, he might develop the proclination of teeth. So we have to think like that. So in postnatal history also it is important. Vaccination history is important to see the immunity of the patient. Habit history and previous any dentist visit, and you have to see the progress in the school also. This is important because even a dentist play a role in identifying the abuse of a child. So these are important in taking the histories. Past dental history, so that we will know the patient, his or her experience during the past history and any complications experienced by the patient. So this is the importance of the past dental history. Family history. Family history, there are few familial diseases or genetic diseases in the families, hence you have to ask about the family history, so that there are few diseases for the risk like asthma, diabetes and cancer and heart disease, and there are few inherited anomalies also, hence you have to take the family history. Personal history, it includes diet, appetite, bowel and micturition habit, sleep, oral hygiene measures, oral habits and adverse habits. All these are the personal history. Diet. Diet includes a soft diet or a coarse diet, carbohydrate or a vitamin diet, because in soft diet, because of the patient may have more prone to dental caries. Coarse diet, if he takes, he'll go for the attrition. Carbohydrate and vitamin diet, if increased carbohydrate, it may leads to the dental caries, and if there is a deficiencies in vitamin, he may have enamel hypoplasia. Hence diet is also important. Appetite, whether it is regular or irregular. Bowel and micturition, regular or irregular. Sleep hours also, because insomnia occurs in case of primary thyrotoxicosis, and even this stress is related to the sleep. And in our practice, stress is important because we will see oral lichen planus or MPDs or TMD problems in the stress patients also. So sleep pattern is also important for us. Habits. Oral hygiene method, whereas he has a very good oral hygiene and his brushing technique, everything you have to see, because if brushing technique is wrong or hard brushes he use, he may have any abrasions, or if poor oral hygiene, he may have gingival problems, or he may have a periodontal disease or a dental caries. Oral habits, as we discussed, habits like thumb sucking, lip sucking, all you have to evaluate, so that all the malalignment of teeth or the jaw development completely depends upon the oral habits also. And finally, the deleterious habits like tobacco, smoking and drinking habit, the patient have a high risk of cancer development. So you have to check this deleterious habit also. So till here, these are till personal history. This is one part of case history. Just go through, and if any doubt, please ping me. Thank you.